I'm Dr. Ajay Narasimhan, Thoracic Surgeon at Apollo Hospitals, Greams Road, Chennai. We have with us Mr. Evans Okoth from Kenya. He was referred to us from the medical oncologist with a diagnosis of a neuroendocrine tumor in his left main bronchus, which means he had a tumorous growth in the left main bronchus. So initially, we had planned to, from looking at all the reports and everything, we thought it would be best for him to have his left lung removed, entire left lung removed. And but him being very young, only 31 years old, we thought if there was an option to preserve some bit of his lung, it would be great for him for a short and the long term. And so that's what we did. So we assessed the CT scans, we sat down with the radiologist, had a good discussion with the radiologist, the pulmonologist, everybody, and then we decided to operate on him. Intraoperatively, we found we could salvage or we could save a portion of his lung, namely the left lower lobe. So what we did was we re-anastomosed the left lower lobe bronchus to the left main bronchus. This is known as a sleeve left upper lobectomy. We removed only the upper lobe along with the tumor and a part of the left lower lobe bronchus. This is special because the easier option and the safer option would have been to do a pneumonectomy, and it would have been easy for him. The recovery would have been easy. But in the long term, removal of one lung causes other problems which might have been saved because of this lung sparing surgery. Now he has more than 50% of his lungs still remaining, and there is absolutely no tumor. And even the medical oncologist has said it needs to be reviewed only after 4 months and no adjuvant therapy as of now. This was possible because of the institution like Apollo Hospitals. And as I always like to say, surgery is not a one-man show. It is always a team effort. I would like to thank my anesthetist, Dr. Bhaskar, and team, namely Dr. Minal, Dr. Ganapati, Dr. Omar, and the pulmonologist, Dr. Narasimhan, for their timely support and bringing out this patient throughout the post-operative period and helping him make a safe recovery. I would like to know if Evans has something to say.
Yeah, thank you very much, Dr. Ajay and the Apollo Hospitals. I've heard of Apollo Hospital while I was in Kenya, and good stories are told about Apollo as far as treating of cancer is concerned. And upon being referred here, I was very happy and very optimistic that my problem would be solved. As I sit here, I'm very happy that the surgery was successful, and I'm going back free of cancer to Kenya. On the other hand, I would also like to appreciate the love and care that Dr. Ajay showed to us. Were it not that love and care, we will not be having confidence on the treatment. Every time we met Dr. Raja, the love they showed us gave us much confidence that all shall be well, and indeed all went well. Apart from Dr. Ajay, the other staffs of Apollo Hospital, especially the nurses right from HDU unit, they were always there 24 hours to ensure that I'm taken care of. When I was moved to the general ward, it was just a matter of ringing a bell and a nurse will be there. And they were really loving and caring. When I left hospital, I had no any doubt that the recovery process will be as fast as it is expected. As I sit here, I feel much recovered and stronger to go back home and happier than I came to Apollo.